Oh man, you know, I couldn't have done any better if I did it myself.
They said let's push together. Okay, let's do it. Is that gonna work?
No, it's good. Yeah, it looks good.
Okay, good. Everyone's like, what? No, you know. They're not gonna want you. Yeah, you are. You're a cool bean.
Or get you are you gonna handle
Hi guys.
Oh yeah, he just said it there. It's fine.
Everybody hear me? Yes, sir. All right, my name is Tom Seibotham. I've been a proud dues-paying union member since 1990. I'm also a business agent for Teamsters Local 406, representing over 7,000 members in Saginaw, Grand Rapids, Traverse City, and the Upper Peninsula. We represent truck drivers, mechanics, warehouse workers, first responders, and medical personnel, nurses, as well as other various trades and industries. The people get up every morning, punch the clock, and keep the state running. Right now, put it simply, we're getting screwed by Lansing. The House Republicans just put on a budget that takes a sledgehammer to health care. They're gutting Medicaid. They're slashing funding programs that our families depend on. And for what? Who is this for except for private insurance lobbyists and who cover Lansing offices every day? We've got nurses out on strike right now. 2 different strikes in different parts of the state. You know what they're fighting for? Basic stuff. Save staffing so they don't have to choose between doing their job right and going home to their families. Fair pay for work, that's literally life and death. And what do these politicians do? They want to cut the programs that keep our healthcare system from completely falling apart. My members are already working as hard as they can in understaffed hospitals. Nurses are burning out left and right. Patients can't get the health care they need. And these guys in Lansing think the answer is to cut more? Are you kidding me? Here's the thing. When we make these cuts, it doesn't hurt them. They've got their fancy insurance. Their kids get the best doctors. But our families, we're the ones who get stuck with longer waits, fewer nurses, and the hospitals that are barely hanging on in every area of Michigan. That's why we need somebody like Jocelyn Benson in the governor's office. She's not afraid to work with Republicans when it makes sense. But she's also not going to sell us out when it comes to stuff that matters, like making sure our families can see a doctor when they're sick. This is a great day for labor. I'm proud, as always, to stand with her. The budget fight represents why we need someone like her in office, and why Local 406 is proud to endorse and stand with her. Thank you.
Hello everyone, I'm Scott Quenneville, President of Teamsters Local 243 here in Lansing and in Plymouth. We represent over 5,400 members of men and women through Lansing and Wayne County. And we're backing Jocelyn Benson for governor. let me tell you something, this budget fight isn't some inside baseball political game. This is about whether working people in Michigan can get health care when they need it. And right now, the House Republicans are trying to pull the rug out from under us. Teamsters represent thousands of workers across the state who could be crushed by the House budget. Workers like the nurses at Corwell and Genesis, who are already on strike because they're tired of working in unsafe conditions. They're tired of being so understaffed that they can't help everyone who needs the help. They're tired of watching patients suffer because there's not enough people to take care of them. And what's the Republican solution? Cut more. Make it worse, force the nurses to quit. It's like they're trying to destroy the health care on their own. You know the difference between a real leader and these politicians? When our nurses went out on the picket line on Labor Day in the cold, fighting for the right to do the right for their jobs, Jocelyn Benson showed up on that picket line.
Yeah!
Not with some photo op. Jocelyn walked the line, she asked the questions, she heard the questions, she answered questions, and she felt the line and she walked it all the way through. That's somebody who gives a damn about the working class. Look, it doesn't matter if you're a Republican or a Democrat. If you're working for a living, you need health care. Your kids need health care. Your parents need health care. This isn't a political game, it's called real life. We need a governor who's gonna fight for us, someone who understands when you mess with health care, you're messing with real families. Someone who's not going to cave when some corporate lobbyists come knocking. Jocelyn Benson gets it. She's been a union member and she's proven she'll stand up and fight. Not just give speeches, but actually fight the fight for the working class people. That's why we're here. That's why we're with her. Because when the chips are down and they're trying to take away our health care, we need somebody in the governor's office who's gonna tell them to go to hell. So, with that being said, Teamsters Local 243 is proud to stand with her. And I'm now here proud to endorse Jocelyn Benson, and I would like to introduce her as the next governor of the great state of Michigan.
Yeah!
Thank you, Scott. Thank you, Tom. Thank you all for being here today. I want to start by thanking the people of the Teamsters, the people, the members who are here with us today as officially joining our growing team to win in 2026. We've got locals from all across the state representing the vast majority of Teamsters in Michigan. Teamsters Local 243 are hosting us today with Scott, Teamsters Local 406 and their Vice President Tom Sidbotham, Teamsters Local 1038 and their President Greg Nowak, Teamsters Local 247 and their President Paul Harrison, Teamsters Local 283 and President Steve Hicks, all representing thousands of members all across the state who I am so proud to be in this fight with. We are going to do everything we can to place front and center the voices of the Teamsters and the voices of the working people of Michigan in every decision I make as governor and every decision we make as a state. And I also want to give a big shout out to Teamsters Local 332, the nurses in the union that are on the picket line right now at this very moment, demanding fairness in the workplace, fair working conditions so that they can deliver good treatment to the patients that they serve. I'm proud and have been proud to stand in solidarity with them. I was there on the first day on the strike, Labor Day, which is where we should be celebrating Labor Day, standing on the front lines with our workers, with these nurses who are truly the salt of the earth. They show up to make others healthier. We should be doing everything we can to stand with them as they show up every day working long hours, multiple back-to-back shifts to make sure our kids, our loved ones, our parents are healthy, are cared for, and that when anyone who gets hurt or sick needs help, that they are there. And that is why the state of Michigan will be there for them. Our campaign is and always has been about people. It's about making sure that people who power our economy can afford to live here and thrive with well-paying jobs, affordable health care, housing, food, water, the opportunity to raise their family and retire with dignity. And let's be honest, while we've done a lot of great things together over the last several years, we are not where we need to be right now to fulfill that promise to the people of Michigan. Because across our state, people are struggling. Everywhere I go, I hear about how the cost of living is crushing our families. Healthcare costs are through the roof. People are rationing medications, skipping doctor's visits, stressed out about insurance coverage, and having to choose between paying medical bills and putting food on the table, and then being left out in the cold when insurance companies refuse to cover their necessary medication. And I believe our job in the state of Michigan as leaders is to fix this broken system. That's what we're elected to do, to show up for the people with a budget that will make things more affordable for every person in this state. And instead of that, here we are 6 days out from a state government shutdown, and the House Republican budget is making it worse. They're making things less affordable for the people of Michigan. The budget proposal guts healthcare funding, slashes Medicaid, and abandons the very people who keep Michigan's economy running. We need road funding, but we can do it without hurting people. We don't need to put parents who are already struggling to afford a doctor's visit out in the cold, so that we can pass more tax breaks for the wealthy and those who already are doing just fine. And right now, nurses, Teamsters are on strike in Flint, and were on strike earlier this year in Detroit to fight for safe staffing levels, to just ensure they have fair wages, basic things that enable them to afford to live while caring for all of us. These men and women are healthcare heroes who showed up during the pandemic every day to take care of us, to help keep us healthy and alive. They never stopped. And how does this state budget now repay them? How are we showing our gratitude? By cutting programs that support patients in our healthcare system and make our nurses' jobs easier. We have to invest in our people, not cut things that are working. And I've heard about these challenges firsthand from parents across the state who are rationing their kids' medicine because they can't afford to pay the full prescription. Michiganders who have to choose between paying for heart medication and paying for rent. That is real pain, real struggles that our citizens are dealing with, and they need our leaders to stand with them and fight for them, and I will be a governor who does just that. And I want to be clear about something. As we talk about this fight that we're in for the future of our state, for an economy that works for everyone, for a life that is affordable for everyone, this isn't actually a fight between Republicans and Democrats. It's not about partisanship. It is about priorities. It is about priorities in a system that too often is rigged against all of us for the few. A system where insurance companies are writing the bills while families and our nurses are footing the bill. It is unfair, and it is an unfair reality that needs to end. I want to build a healthcare system and a political system that works for everyone, making sure people can afford to see a doctor when they're sick, making sure we're supporting our healthcare workers, the nurses, the techs, the people who keep us healthy, with fair wages and safe working conditions, rejecting state budgets that cut healthcare funding and defund our schools, but instead ensure we have a budget that works for everyone. That is not a partisan battle. That's just a battle for the people of this state. Now I know that this seems like a big fight that we're in, but I know how to take a broken system and make it work. I know how to take on powerful interests and stand up to anyone who would stand in the way, the ability of the people of Michigan to thrive. And just as Secretary of State, we've revamped how we vote. We've revamped how people renew their driver's licenses to make government work better for people. That's my North Star. Saving people time, saving people money, treating people fairly, and making sure no matter who you vote for or where you live in this state, that your life is easier because of the work that we do and the leadership that we bring. So now I want to expand that work. I want to start by making healthcare affordable and accessible to every family in Michigan. And I'll tell you, I don't believe anyone seeking to lead this state or anyone leading in any corner of this state should be able to sleep at night when there are families that we lead and serve who are choosing between paying for medicine and putting food on the table. And we should all be working every day, every hour to get this budget done to avoid a shutdown that would hurt or exacerbate the pain that too many families are already experiencing. And that's why I'm running for governor. That's why we're fighting today.
That's why we're building this coalition that you see here behind me, to ensure that we stand together in fighting for the people of this state. Throughout my time leading the Department of State in Michigan, safeguarding our democracy, protecting people's pocketbooks, one thing has become abundantly clear to me, and I want it to be clear to every person in this state, that the power of the people will always be greater than the people in power. Always. And we must choose to harness that. And that's what we're going to do, because the people of Michigan can lead the way, and when they do, when we lead together as a team with the Teamsters, we can win. So let's get together, let's get our legislature to pass a fair budget that works for everyone, and then we're gonna keep building and growing and fighting all the way into November of next year, when we will win across this state. Thank you.
Alright, so happy to get a few questions.
Hi, Secretary. Sorry, cold season was coming. So we heard from, the leaders of the unions that represent state government employees over the past couple weeks or so, that, they're feeling they're not receiving prior notice about whether or not, there are gonna be layoffs if a shutdown does occur next week. And I was just wondering, have any of your employees at the Department of State received any notice from, I guess, DTMB or the State Budget Office of potential layoffs or, I guess, the temporary furloughs?
I think what you're speaking to and really underscoring is the anxiety that everyone's feeling right now as the clock is ticking. And it shouldn't be this way, but the clock is ticking as we careen towards a potential shutdown. And so that anxiety I see in my staff, I see in our branch office staff every day. The hundreds of people that are working for our department have been calling and asking and reaching out to us and saying, what's my future look like? And it kills me because it pains me, because these are folks who have spent in some cases up to 3 decades or more serving the people of Michigan, and now because a budget deal has yet to be enacted, are faced with this uncertainty and this anxiety and these struggles. So recognizing that in our department, we have done everything we can to push out information to our team, make sure they know and understand, and we're acknowledging the uncertainty of this moment. And our dedication continues to be every day, trying to find ways to cut wasteful spending without hurting people, trying to find ways to ensure we're creating that stability for our team, for our staff, so that they know what can happen this week, next week, and beyond. But also making sure we are doing everything we can to get to a deal before there's a shutdown by offering concessions and all the rest, so that we can get to where we need to be without hurting people and giving people the stability that they deserve.
But the notice as is required under public.
We have provided all the information and notices that are required by the law.
Next question.
Through internal communications to our team.
Secretary Benson, we heard a lot of talk today about how this budget fight is evidence for why we need your leadership in the governor's office. How do you think this situation will look different if you were the governor today?
Well, I think 3 things. One, I am inherently not a procrastinator. I always like to get things done sooner rather than later. So as governor, I'll be on that floor. I'll be building relationships with every single lawmaker and legislature early on in my tenure, so that we can understand our respective needs and challenges and come up with an agreement sooner rather than later, and push for an agreement and not allow 1 or 2 people to hold up the process until we get to this point. Secondly, I think the process needs to be transparent. We need to invite the people into the process so that they understand every step of the way what the discussions are, what the pressure points are, what the bones of contention are, so that we're bringing the people into the process, because this is their budget too. And then finally, making sure there are consequences if it's 1 or 2 people holding up a process that causes pain for millions of others. It shouldn't be the case. We shouldn't be here. But it starts with working early, working together, and working transparently for the people of Michigan.
Sarah?
Secretary Benson, you certainly named healthcare affordability as a top priority in your campaign. Can you just talk a little bit more concretely about your policy proposals on that front? Like, what changes to state law would you like to see made if elected as governor?
Well, one of the things that's most top of mind to me as the administrator of one of our largest agencies is that another one of our largest agencies, the Department of Health and Human Services, is consistently underfunded and not at the capacity that it needs to be to actually serve the people of Michigan. One of the stories I've heard consistently around the state is also about insurance denials that happen and without any support for appeals. I'd like to see the Department of Health and Human Services have the capacity and support to be able to appeal wrongful insurance denials on behalf of the people of Michigan, so that we can ensure no one is wrongly blocked from paying for medication because of an overly bureaucratic insurance process. Overly bureaucratic is also how you could potentially describe many departments in the state, including that one, in part because of antiquated processes that I saw myself when I came into the Department of State. So working with those at DHHS to ensure we're investing in them, we're creating more streamlined and efficient processes so that they're able to deliver for the people of Michigan and take existing policies and make sure that we are making healthcare affordable, accessible, and on the side of people when they get those wrongful denials. That's some of what we can do better from an administrative standpoint in the state to ensure that department is helping to make healthcare affordable and equitable for the people of Michigan. It's also finally not lost on me that rural healthcare is top of mind for hospitals that are facing closures as a result of these budget cuts, but also for residents of rural areas throughout our state. And you see this, Tom, oftentimes all around Michigan, we need to be investing and supporting with these local employers, these local hospitals, and their staff to make sure they can continue to provide the support that they are providing in rural communities, but also develop unique ways to meet rural residents where they are and deliver healthcare services that they don't need to drive miles and miles and miles in order to get the necessary healthcare they need.
Just a quick follow-up on that. Do you think the state should raise new revenue to blunt the impact of federal Medicaid cuts?
Yes, I believe we need to be doing, one, we have to vociferously and unrelentingly push for restoration of those federal cuts to Medicaid every day, every time we have an opportunity. The budget process at the federal level is ongoing, and so our advocacy for Medicaid funding needs to be ongoing and unrelenting. But secondly, we do have to identify sources of revenue and new revenue sources in this state to fill some of the gaps and apply for additional funding available at the federal level to try to still fill some of those gaps, including looking at public-private partnerships that can help invest as a Band-Aid in times until we get a restoration of that federal funding. Another thing I'll do as governor is work with governors in other states, because healthcare needs do not necessarily know state boundaries. So can we create economies of scale with other neighboring states who are dealing with similar challenges, and partner with other governors to identify cost-saving mechanisms that we can develop together as a region to deliver those savings onto our residents.
Yeah, Secretary, to what extent are you able to keep branch offices open, if you have any ability at all, in case we don't have a budget on October 1st?
Branch offices will need to shut if there's a state government shutdown. However, online services will still be available, as well as self-service stations. We are encouraging residents to get to those branch offices now in the event that they do close, but we have a number of ways that we can keep things going, at least for a short time, if the budget shutdown does occur and is a temporary one.
Is that your decision, or is that from the governor's
That's
office?
just, without a budget, we can't keep the 130 branch offices open, period. And we've made that abundantly clear to everyone in these discussions.
Secretary, you talked a lot about some of the kind of real implications of the shutdown on people's lives. From a political perspective, there's lots of chatter out there, and I'm sure you've heard this, that if there's a shutdown, that's gonna help Mike Duggan in his argument that, hey, the two parties aren't working. They can't even get the budget done. What's your response to that?
There's a shutdown. The people who will be hurt are the people of Michigan, period.
But they might blame the two parties.
The people who should be blamed are anyone who is standing in the way of enabling us to reach a deal. But also a broken process, a broken system that started long before this week, and isn't, as I mentioned, related specifically to parties, but a broken infrastructure, a broken system that too often benefits the few over the many. So in my view, I'm not running against partisanship, I'm running for a collaborative government that begins on day one working together, and I'll set that tone as governor. That collaboration can come from both parties, and it must, because no matter who is governor, you have a responsibility to work together with everyone. And I've always done that as the Secretary of State, as a Democrat, proudly, standing for the people, standing against any policies that will hurt the people of Michigan. But guess what? Republicans don't want to hurt the people of Michigan too, I hope. And so as governor, I'll work with them across the aisle to find ways where we can agree and get stuff together. And that to me is actually government functioning in a bipartisan system. Parties working together to deliver for the people that they represent. So that's the leadership I've always fought for. That's what I'll bring together. And to me, a budget shutdown is emblematic of a broken system where we need more leaders willing to collaborate and work together, not go it alone in order to make a point or prove a political posture, always be someone who will prefer collaboration and prefer frankly bipartisan collaboration over any other path, because that's how we actually create a better budget for Michigan.
Secretary, you spoke about healthcare here. There were other proposed cuts made to other agencies such as EGLE, state police. Are there other elements of the proposal that you take issue with?
Yeah, this is a budget that defunds our schools, that defunds our police, and that defunds our healthcare system. It is a hurtful budget at a time where it's not necessary. We can actually cut wasteful spending in state government without hurting people. I've done it in my office. Others have worked and proposed things that will do the same. And so that's what I'm imploring everyone in Lansing to focus on. How do we ensure we eliminate wasteful spending, eliminate unnecessary bureaucracy, make government work well for everyone without causing pain? That's our job. And the proposals we've seen through defunding the police, defunding our schools, and defunding our healthcare will only cause more pain to the people of Michigan, will only cause the cost of living to increase, not decrease, at a time when we need to be doing the opposite.
Time for one final question. I got something kind of random for you.
Love the random questions.
Yeah, so, the conversation about moving the, primary from, August to May, any thoughts?
I mean, as the chief election officer for the state of Michigan, my focus will be, just as it is with the special election, being prepared to make sure our elections are run well, no matter when the dates may be. And so that's been our focus. And I will just recognize the 1,600 clerks, 83 county clerks, 1,500 local clerks throughout our state. They're the ones who show up every day to make sure whatever policies pass, whenever there's a special or a statewide election, that we deliver for the people of Michigan. So my job will continue to be to focus on them, to support them, and no matter when a date of an election is, and we will be ready, we'll be able to do it just as we always have. I'm endlessly grateful for the election administrators who stand ready to go to ensure the policies that are